Hello everyone. Today we are going to learn about Caesarean scar niche. This is an important topic and there is also a talk article about it. So it's also important for the MRCOG Part 2 exam. So first I will explain what a Caesarean scar niche actually is. So definition. Then I will show you an ultrasound video and some pictures so you can clearly see how it is diagnosed. So ultrasonography, images and videos. After that, we will go step by step through the risk factors, the symptoms and the management. So, risk factors, symptoms and management. So, let's begin with the definition. A Caesarean scar niche. Sometimes also called an isthmosis or a scar diverticulum. Another name is isthmosis or scar diverticulum. So, Caesarean scar niche is basically a defect at the site of previous Caesarean section scar. Previous Caesarean section scar. So, Caesarean scar niche is a defect at the site of previous Caesarean section scar. So, let's see some ultrasonography pictures. Look at this. This defect is Caesarean scar niche, which forms a small pouch. Look at here. Ultrasonography shows a triangular hyperkick defect at the Caesarean scar site with base blue line and depth is green line. So these all are ultrasonography pictures of Caesarean scar niche. So look at here, there is Caesarean scar niche defect. This is a talk article of Caesarean scar niche. The topic is gynecological morbidity associated with Caesarean niche, increasing awareness, prevention and management. This is a talk of 2020. MRCOG Part 2 candidate must read this one. So now, what are the risk factors for developing of niche? Risk factors. One is, the most important one is multiple Caesarean section. Multiple Caesarean sections. The second is making a very low uterine incision. Low uterine incision. The third is poor surgical closure technique can also contribute. Poor surgical closure technique. Other risk factors include retroflexed uterus, infection or poor wound healing. And there is another risk factors is a short gap between pregnancies. So these all are risk factors of Caesarean scar niche. If I tell in a short, then I can tell that anything that disrupts proper healing of a scar can lead to a niche. So what is the symptoms? What is the symptoms of Caesarean scar niche? Most women with a niche are actually asymptomatic. Most women are asymptomatic. We often find it incidentally during an ultrasound scan. But some women develop symptoms. What is these symptoms? The classic symptom is postmenopausal bleeding. Postmenopausal spotting or prolonged bleeding. So what does this happens? This happens because blood collect inside the pouch, then leaks out slowly. And patient may also complain pelvic pain or dysmenorrhea. Pelvic pain or dysmenorrhea. Another very important consequence is secondary infertility. Secondary infertility. This may cause because of retained fluid may interfere with implantation. And also there is increased risk of uterine rupture in future pregnancies. So how do we diagnose it? The first line investigation is transvaginal sonography. So I have already told it, in ultrasonography there will be a triangular or semicircular hyperacute defect in the scar area. Triangular or semicircular defect in scar area. And sometimes we can perform saline infusion sonohysterography. Sonohysterography to detect a clear outline. And in complex situation, we might use MRI. So lastly, how do you manage a Caesarean scar niche? Management. If woman is asymptomatic, then usually no treatment is needed. No treatment. Just reassurance. If she is symptomatic, then we have two options. First is medical treatment. Second is surgical treatment. So in case of medical treatments, this includes hormonal methods such as combined oral contraceptive pill or levonorgestrel releasing intrauterine system. These help control the abnormal bleeding. So what is the surgical treatment? If niche is shallow, we can do hysteroscopic resection. Hysteroscopic resection. This removes fibrotic tissue and improves both bleeding symptoms and fertility. So this one is for shallow niche, and in case of deep, we may need laparoscopic or transvaginal repair. So this helps to reveal the normal thickness of uterine wall. So this is all about Caesarean scar niche, and it's definitely an important topic, so we need to understand well.